Hi, good evening, everyone, and welcome to the UP COVID-19 Community Town Hall for the Upper Peninsula. I'm Steve Elmer, a college professor and member of the Health Research Institute here at Michigan Tech University. Shortly, I'll be joined by my colleague and co-host, Kelly Camp, who's an epidemiologist, and our speaker panel for tonight. It's important to recognize our sponsors, which include the Michigan Health Endowment Fund, the MTech Smart Zone, Aspirus, UP Health System Portage, the Physiological Society, and once again, we really appreciate all of our sponsors here tonight. Our series is organized by the Health Research Institute. Their mission is to support health-focused research, education, training, and outreach here in the rural Upper Peninsula. We also want to formally welcome all of our viewers that are joining us tonight on the Zoom webinar, on Facebook Live, and those listeners tuning in on 97.7 The Wolf Radio. It's great to have you with us, and kudos to you for doing your part to stay informed. The goal of tonight's town hall is to help increase awareness about COVID-19 and how it impacts your health, the health of your family, friends, community members, and society at large. To do that, we'll bring in a panel of experts, including physicians, pharmacists, and other community experts to provide information and, most importantly, answer questions that you have. All of our town halls are recorded to date. This is our 22nd town hall. Some of the topics we've covered this fall include dealing with the Delta variant, pulling together through tough times, and some of the lessons learned during the pandemic. Our town hall recordings are archived. They're publicly available on our website, so you can watch those at any time. That website is mtu.edu/health-research. Once you're on the page, go ahead and click on Town Hall, and you can again view previous recordings. Tonight's town hall will also be rebroadcasted on ABC 10 in Marquette at 12 p.m. Eastern this Sunday. Next, I want to welcome in my colleague and co-host, Kelly Camp, who again is an epidemiologist by training. She's a member of the Health Research Institute here and a college professor. So Kelly, good to be working with you again tonight. Can you tell us what's coming up and who's here and some of the things we'll be talking about?
Thanks, Steve. I'm glad to be here. We have a panel of 6 different panelists tonight, so we've got a full plate. And as you mentioned, we've looked at a lot of these of our webinars have really kind of focused on one particular area. This time we're really focusing on it broadly. So we have quite a variety of within our panelists. We are starting off with Dr. Tim Labonte, who's a hospitalist with UP Systems Portage, Health Systems Portage. To talk about, from the medical side, the symptoms and illness. As we've learned more and more throughout this pandemic, a lot has changed, and he's going to update us on what's going on from the medical perspective. Then we have 2 pharmacists speaking to us, as we've probably all experienced the benefits of having our pharmacists being able to give vaccinations. And so we have Jessica Besner from Aspirus and Anna Kempke from UP Health Systems Portage to talk about vaccines and boosters and the efficacy and all those questions that we've all been dealing with about the vaccines and what the best information we have on our vaccines is. And then we have Siddharth Chandra, who's a professor at Michigan State University. So we welcome him in from downstate, representing our partners downstate, to talk about the historical implications of the Spanish influenza pandemic and how that relates to what we're seeing today here. Our 5th speaker is Dr. Jason Bombard, who's a psychiatrist from Aspirus. We've all been experiencing the mental health impacts of the pandemic for the past couple of years. So Dr. Bombard's back on for the 3rd time to speak to us about mental health and well-being as we continue to deal with the implications of this pandemic. And our final speaker is Elise Burr, who's the director for the Center for Rural Health at Northern Michigan University. And we've been blessed with having yet another university represented, to have the Central UP represented, and Elise to talk about community health initiatives across the UP. So I'm excited to hear from all of our panelists tonight.
Kelly, thanks for the introduction there. And before we introduce Dr. Labonte here in just a few minutes, can you set the stage and help us see where we are from both a national, state, and importantly, a local perspective here across the UP with case trends, hospitalizations, and all things COVID-19?
Sure. So as always, it's a mixed bag. Unfortunately, what we are seeing now is national numbers are trending upwards again. As we've seen throughout this pandemic, it's not consistent across the United States. Cases are climbing in some areas, they are decreasing in others. But generally in the region of the Midwest, cases are rising. Michigan is one of the highest rising case counts in the United States right now. We are at a level that is higher than we have ever been before. So we are definitely seeing increases in cases. Locally in Houghton County, our rates are a little bit lower currently than they were before Thanksgiving, But I would caution everybody to think about the case rates right now. They get a little jagged on these peaks around the holidays. Many of us were not working on Thanksgiving. We appreciate all the clinicians who were working, but public health took the day off in terms of reporting. We were still, public health was still working. So we're still very high in Houghton County, 361 cases per 100,000 in the last 7 days. And our test positivity with the latest numbers is 27%. So super, super high. We are definitely in high transmission. So remembering to wear your mask anytime you're indoor, regardless of vaccination, washing your hands. As our pharmacist will be speaking about, absolutely get your vaccination, get your boosters. And one thing that I do want to remind everyone is that if you do test positive, you need to stay isolated for 10 days after your symptom onset, or a positive test if you do not have symptoms. So no getting out of that 10 days early. You can't test out of that. You do need to isolate to prevent spread of this disease for 10 days after you test positive or your symptoms start. And it is on all of us to fulfill our social contract with each other to keep our community safe. So that means that we do need to follow all the public health guidance and protect each other. I would remind everybody that nothing's 100%, but vaccines are our best bet to stop this virus. In Houghton County, only 49% of our population is fully vaccinated, but that means that there's been 17,000 people who have gotten fully vaccinated in our county alone. So we do have lots of data. Jessica and Anna will be talking about vaccines further on this, but I would want to remind everybody that without being vaccinated, this is really putting you at risk, not only putting your community at risk, but puts you individually at risk for having severe complications related to COVID. Most recent numbers have come out in Michigan, broadly across Michigan, that of the COVID patients that are in the hospital, 3/4 of those patients, so 76%, are unvaccinated. And in patients that are in the ICU, so COVID patients that are in the ICU, 87% of those patients are unvaccinated. So it is our unvaccinated populations that are more likely to be hospitalized and in the ICU.
Great. Kelly, before we move on, of course, we're hearing a lot in the news about this new COVID-19 Omicron variant. Can you just briefly introduce that for our listeners and viewers and just get us up to speed on that a little bit?
Sure. So viruses are wonderful at learning at mutating and becoming more and more infectious and able to survive longer in the hosts. We are those hosts. It is new. We are very grateful to South Africa for being on the ball with catching this and being able to share that information worldwide so that everybody can keep an eye out for it. At this point, the reason that it's very concerning is because it has a lot of mutations that are concerning in terms of, is it more transmissible? Like Delta was more transmissible than Alpha. Also, that there is concern that some of these mutations may indicate it might be able to evade some of our immune system functions. Right now, the question is, we don't know. It's new. We're keeping, we're worldwide keeping an eye on this to see what's going on, but those mutations are concerning. And that's why it's a variant of concern to watch out for. We don't know if it will outcompete Delta or not. So there have been other variants that have come out that have had some concerning mutations that don't end up outcompeting Delta. So there's a lot that goes into that, but it's one of those things we need to keep out for. And basically we learn as we go. It's a novel virus. Novel variants, we just have to keep our eyes peeled.
We appreciate it, Kelly. We'll continue to check back in with you throughout the town hall. Next, I want to welcome in Dr. Tim Labani, who is currently at the hospital treating patients right up until the town hall. So we really appreciate you making time for this, Dr. Labani. Good to have you back. It's been you were on about this time last year. So tell us what you're seeing on the front lines treating patients. So I'll turn it over to Dr. Labani.
Thanks for having me. It's a pleasure to be here, and I want to say hello to all of our listeners out there. Boy, a lot has changed in the last year, both in the fact that we know so much more about this virus, but also with the mutations that Kelly was describing, this virus has gotten a little bit nastier as well. I can tell you that I actually worked over the Thanksgiving weekend, and so things were very, very busy. My experience certainly correlates with Kelly's description of the numbers locally here in the Houghton Hancock area. We've seen a tremendous uptick in cases in the hospital. We, both here locally and throughout the state of Michigan, we've been admitting several patients. I think just like we were saying last year this time, the spectrum of disease with this virus can range from minimal to asymptomatic to acutely ill on a ventilator and everything in between. Certainly the vaccine has changed that to where folks tend to be a lot less sick. But as you mentioned, roughly half the people in our area here are unvaccinated. And so we're certainly seeing the repercussion of that in the hospital. Lots of ICU patients, lots of patients requiring, a tremendous amount of oxygen. I can tell you that I have yet to see one person in the ICU that was vaccinated. We've had a couple of people in the hospital that were vaccinated with fairly minor symptoms. I would say these were more elderly folks that presented more with like a weakness rather than respiratory symptoms. The spectrum of disease is roughly similar. We're seeing folks with more isolated GI symptoms, nausea, vomiting, diarrhea, without any respiratory symptoms, which is a bit different than last year. And then we're seeing folks, like I said, with just the classic respiratory symptoms. Sore throats and headaches and nasal congestion are fairly common now, where we weren't seeing as much of that before. So I can tell you that the people in the hospital that I'm treating are much sicker than what we had treated before last year this time. That the acuity has gone up significantly. Our average length of stay in the hospital before COVID was about 2.5 to 2.8 days for a person. We're seeing that roughly go up to 2 to 3 weeks right now. People are in the hospital for long periods of time. And so, what that does then is it ultimately fills the hospital. And, and that's what we've been experiencing. Full beds, lots of people in. We've been managing well. Our administration, our leaders here locally are listening to what we need, and they're responding in a huge way. We're able to provide the care that our community needs for us. That last year this time we had 3 high flow units that we were able to provide a high level of oxygen to people, which I'm sure we've all heard about. We're currently at about 8 units right now. We've increased our ventilators. We've increased staffing, and both with nurses, aides, and the medical staff. So we've really been able to meet the challenges that our community needed, and we've been able to rise up to those expectations. I think one of the things that I want to comment on that I hadn't talked about last year sort of is the patient without COVID. And let's think about what that looks like. Okay, so let's say we don't have COVID, and maybe we've got our vaccine, and maybe we're in pretty good health, and all of a sudden something else happens, a stroke, a heart attack. Let's think about that patient for a while, because I think that's what we're seeing a lot of. Those patients, let's say if they require a transfer out to a larger hospital, Marquette or Wausau, or one of these more local, higher level of care, I would say that you're waiting in the emergency room right now of average about 2 to 3 days. 2 years ago, that would have been unimaginable. You would have waited in the ER for maybe an hour or two. Sometimes during a snowstorm, maybe a little longer. We have to kind of meet those challenges, but it's about 2 to 3 days right now. And to get the person to that higher level of care. For patients requiring really a tertiary level center of care, now we're talking maybe the University of Michigan or somewhere in Green Bay or Milwaukee. 2 to 3 weeks, I would say, is what we're experiencing right now. So again, the burden that COVID has played on the hospital system right now and filling these beds, not only with higher numbers of people, but for people that require these beds for a longer period of time, is sort of, kind of falling backward on to folks that, would have needed those beds for other reasons. And so really what it's doing then is the smaller hospitals are filling up, waiting for transfers. The emergency rooms are filling up, boarding patients to be able to transfer those patients out. And then ultimately, if the nursing homes are full of patients, then we've got nowhere to disposition them. So that's been a huge challenge right now is the movement of patients, I would say.
Dr. Labani, a question here to kick things off. We're hearing more about advances in some of the therapeutic treatments for COVID. Can you tell us more about those? Are they available? Are they effective? And how do those stack up to, of course, the vaccine?
You know, honestly, I've told people in the hospital this, there's a couple of medications that we have available to use that are good, but they're not miracle medications by any means. The vaccine is by far, in a way, the best weapon we have against COVID. It's the prevention. Not only the prevention, but maybe the weapon we have to minimize the symptoms. Once in the hospital, there's a routine care that we give, and one is a steroid called dexamethasone. I tell people it's been around for 100 years. I don't know that. Maybe it's been around longer or not, but it's been around for a long time. We've been using the medication for many other things, but that seems to help people who are requiring oxygen in the hospital. I've seen some really big improvements there. There's another medication that we have called remdesivir, which is an antiviral medication that has also been shown to improve time to recovery in patients on low amounts of oxygen. I wouldn't say the mortality benefit is tremendous, but we have been using it, and certainly it's got a reasonably safe profile. I want to comment that I'm getting a lot of feedback right now from patients in the community that are very leery about this medication, the remdesivir. So I'm thinking that there's some discussion going around the community or some kind of information out there that this medication is bad for you and it's got a bad safety profile. And I can tell you I've used it in countless cases and I've not seen any major adverse effects. Certainly we're monitoring for all of those things closely in the hospital, and so I've not seen any issues with that. And there's another medication that we have called tocilizumab or Actemra that some folks with advanced RA have received in the past, or other. It's an immunosuppressant and it's an infusion. Right now, it's very hard to come by. It's very difficult to get, but it's indicated for patients that have increasing oxygen requirements with COVID that may end up on a ventilator, and that has actually shown an improvement in mortality as well. Unfortunately, we're not able to offer that to as many patients because it's very difficult to procure. I think Anna could comment on that side of it. But generally speaking, we have provided to our sickest patients here at Portage, and we continue to do so. We've been able to allocate enough for our sicker patients. So that's basically it. But ultimately, it's like any virus. Antibiotics don't work. The best treatment is supportive care, and the best treatment is prevention, and that's ultimately that's going to be our best weapon. I tell people, that the best thing is to not even see me in the first place.
Thanks so much, Dr. Labani. We're going to continue on here. I just want to remind folks a couple of things. If you have a question for us, you can send those in two ways. You can email those to us at townhall2020@mtu.edu. If you're on the Zoom webinar, you can use the Q&A button at the bottom to send us questions. Next up, we're going to have two pharmacists here. We have Jessica Bester from Aspirus and Anna Kemke from UP Health System Portage to talk about vaccinations. So I'm going to turn it over to Jessica, and then we'll have Anna follow up after that.
Good evening. Thank you for having me. I think I wanted to start by talking a little bit about vaccinations. What I will do is I will start with our youngest population and kind of work our way to the older population. So probably since the last time this webinar happened or this Zoom happened, we've experienced approval of the pediatric vaccinations. That was approved at the end of October, right around Halloween time, and we started vaccinating our age 5 to 11-year-old children probably early November. So to comment on the vaccination rate through the community, our children have probably just started to get their second doses in, which will lead to that higher vaccination percentages, as Kelly was mentioning earlier. So first we have our 5 to 11-year-olds who are now eligible for a Pfizer vaccine. Just like adults, it's given in a 21-day regimen, first dose on day 1 and second dose on day 21. Unlike adults, it's given in a lower dose than the adults. It's about a third of the volume, or a third of the dose that adults are getting. It is an actual different vial. It's a different vaccine than what the adults are, but it's just because of the lower dose. Next new news that we have is that boosters have been expanded to anyone who's older than the age of 18. That is probably new since the last Zoom meeting that we've had. Prior to this, we had boosters recommended for our more elderly population, as well as those who had occupational hazards. So our healthcare population were recommended to get boosters. Our Pfizer dose was first to come out as a booster possibility, and then our Moderna dose was recommended second, with a 50% dose reduction. So if you got a Moderna series and you wanted to get a booster, you're getting a booster at a lower dose than the Pfizer. Those are the two big topics or new information on vaccinations. Additional information that has been around for a little bit of time is that anyone who has gotten a Johnson & Johnson dose is recommended to get a boost of something else within, I believe it's 2 months after the Johnson & Johnson dose. It does not matter which drug, but it is recommended that we give a boost with something. And that brings me to the ability to swap doses. That is another probably newer bit of information. It has been determined that it's equally as effective to, say you start your series with Pfizer and want to convert over to Moderna because of availability or flexibility. It's equally as effective to convert over to Moderna or to convert over to Pfizer. And of course, if you got a Johnson & Johnson, it's effective to move to either a Pfizer or Moderna dose. So those are the little bits and updates, tidbits on the vaccination. Next, I will go into availability. A year ago, it was a hot commodity. We had so much demand and so little supply. Then the tide switched and we had so much supply and very little demand, probably leading into July, August, even into September. We were actually having a hard time with vaccines expiring on us. We couldn't push the vaccines out before they were expiring. Now it's changed the tide again to this time of the year where our boosters are fully out and available to anyone over the age of 18. Our pediatric doses are out and available. Supply is seeming to meet demand right now. If I would say anything, the drug supply is there. The capacity to administer the vaccines is a little bit cumbersome or a little bit of a struggle right now. As Dr. Labonte indicated just a little while ago, we're taking care of so many sick patients in our EDs. We're taking care of so many patients on our floors. So there's less nursing staff to be able to administer the vaccines in some of our clinics. Likewise, our pharmacies, our retail pharmacies are back to full-blown business. After some of the shutdowns that happened a year ago, maybe volume was a little bit lower, but now we're back into full swing of normal businesses or normal business. So the availability of the vaccine is here as a drug. The availability of the appointments is a little bit cumbersome just because of the shortage of workers to be able to do this as well as doing the other things. And so some of our health systems are having to make the decision of how do I give the vaccine, take care of the sick patients, take care of the well patients in the clinic, take care of the non-COVID sick patients in the hospital, and then also try to see if we can give any sort of the outpatient therapies for COVID as well to prevent hospitalization. So it becomes a Sophie's choice type of phenomenon right now. So I guess my final request would be to be patient with our healthcare partners throughout the entire Upper Peninsula and state at this point, because we're all trying to do many different things, and we really appreciate your patience and your grace in this time.
Hey, thanks so much, Jessica. We certainly appreciate everything that you and your colleagues and your team are doing to keep us safe and healthy. And let's continue the discussion. We'll turn it over to another pharmacist. We have Anna Kemke here from UP Health System Portage. Anna, go ahead.
Great, thank you. So to kind of bounce right off of what Jess was saying, so since December of last year, over 450 million doses of the COVID vaccine have been given in the US. And prior to that, tens of thousands of doses were given in clinical trials. So we do have a lot of experience now with the vaccines. And in addition to that, the vaccines have undergone and will continue to undergo some of the most intensive safety monitoring that the US has ever done. So this includes established safety monitoring as well as new monitoring that they've done because of these vaccines. So I'm just going to mainly touch on some of the side effects and safety, and then wrap up with some of the efficacy or effectiveness of the vaccines. So overall, the vaccines have been shown to be really safe. Some people have no side effects when they get the vaccine. More often, we do have minor side effects, so the swelling, redness, pain at the injection site, fever, headache, tiredness, muscle pain, chills, nausea. I think if you talk to anybody who's had the vaccine, those are pretty common side effects, and they resolve, within 24, 48 hours, depending. There are some serious but very rare side effects that are on kind of that vaccine screening checklist that may cause people some pause. So I wanted to touch on a few of those just to kind of talk about how rare they are and what they are. So the first one is just anaphylaxis, a risk with really any medication, any vaccine. There's about 11 cases per million for these COVID vaccines, so still very rare. Another serious, but again, rare side effect that is only associated with the Johnson & Johnson vaccine is the blood clotting with low platelets. And so this is rare in that it was seen in about 7 per 1 million vaccinated women. So pretty much it's women less than 50 that have this risk. So still pretty rare. And again, only with that Johnson & Johnson vaccine. It has not been seen with the mRNA vaccines. And then kind of the last main category is the myocarditis and the pericarditis. So these have been reported in adolescent and young adult males who have received the mRNA vaccine, specifically after that second dose of the mRNA vaccine. So despite this risk, the recommendation still is for these patients to get the vaccine because it is still such a rare side effect. And then so far, now that we have been doing the boosters for a little while, the side effects have been pretty similar. So kind of the general common side effects that we've heard, some people have very similar to the first round, some have a little less, a little more, but nothing major or new that's been popping out with these new booster doses. And then moving on to kind of the efficacy of the vaccine. So these vaccines have been shown to be really effective at preventing severe illness, as Dr. Labonte said, and limiting the spread of the virus. So all of the vaccines that are currently authorized show efficacy. So they showed efficacy in the clinical trials, and we are seeing that efficacy in real world patients. That being said, no vaccine is 100% effective. We are going to see those breakthrough cases, and we have seen those breakthrough cases. However, the data is showing that vaccination can help your symptoms be less severe. And so even if you do still get COVID, the hope would be that your symptoms would remain mild. And then if the vaccines are so effective, why are we doing booster doses? So the data is showing that vaccination does appear to lose efficacy over time, and that could be due to reduction in protection, but also potentially greater infectiousness of the new variants that we kind of touched on. So although infection prevention can kind of diminish, the protection you get from the vaccine as far as preventing severe disease or hospitalization remains. So it's still really important. I know you'll hear from a lot of people who got the vaccine and maybe still got COVID, but again, the severity of that illness is far, far less in what we've seen.
Great, thank you, Anna. Question for either one of you here to get started. This question was sent to us ahead of time, talking about if I have had COVID-19 and I've recovered, do I still need to get the vaccine? The other one to follow up on this is I've had COVID, I've had the vaccine, but do I need to get the booster? So thinking about immunity and potentially waning immunity and the protection that you have.
I'll take the first one and Anna can take the second one. How's that go? Yes, if you've had COVID, we understand that there's some immunity that comes from the virus itself and the natural pathways that your immune system has taken. But it is still recommended to get the vaccine after you've recovered from COVID. Now, it depends on if you've had any sort of antibody treatment versus no treatment at all, depending on the timing of the vaccine. So for example, if you have had a COVID antibody treatment, it is recommended to wait for 90 days until you get the actual vaccine or the booster. But it is still recommended to get the vaccine. Reason is that we don't know how much of a strong immunity that was built. We don't know how much immunity was built in your immune system through that viral process. And we do know that the vaccine does give us some more immunity and some longer lasting immunity, regardless of that status.
Yeah, and to add to that, the answer is yes. If the question is should I get the vaccine? Almost always the answer is yes. There are some stipulations, as Jessica said, with the timing of that vaccine. For the most part, as long as you're kind of outside of that quarantine, acutely ill stage, you would be okay as long as you meet other criteria. And again, you haven't received the monoclonal antibody treatment, but getting the vaccine gives you that kind of broader spectrum of immunity or antibodies against kind of these different variants that we do see. So it kind of gives you that extra protection.
And Anna, one final question here. Do we know if the current vaccines, or when will we know, I guess, if the current vaccines will help us against this new Omicron variant?
So we believe that it will. The level of protection is kind of unknown at this point. So over the next couple of weeks, there's a lot of people, a lot more important than me, doing a lot of work to see what all of our current therapies, how they'll kind of stack up. And it just takes a little bit of time to really test everything out to make sure all the antibodies are still the right choice. So for right now, the recommendations still stand. And as we hear more, things can evolve. But I'm kind of hearing that it should be okay. And people are looking to check things out now.
Great. We are just about halfway through our COVID-19 community town hall. If there's any radio listeners out there that are tuning in, and if you want to see the visual content, a great way to do that is hop on over to thewolf.com and you can click on Zoom or Facebook and join us here. We're talking about all things COVID-19. We have an excellent panel of speakers here. I'm going to turn it back over to my colleague and co-host Kelly Cam here in just a minute. I want to recognize our primary town hall sponsor, which is the Michigan Health Endowment Fund. So Kelly, we've been talking about vaccines here. I want to circle back to the importance of testing. And I know that there's testing available here in our area. Can you just give a plug for why testing is still so important, even if you are vaccinated, and where can folks get tested through the Western Upper Peninsula Health Department?
Sure. So absolutely. If we don't know that you have it, we don't know how to make all the recommendations for how to prevent you from spreading it. So not getting tested and kind of pretending it doesn't exist doesn't really work in public health. We do need to know if you are infected so that we can know to trace your contacts, because this virus, you are infectious for up to 2 days and sometimes 3 days prior to having symptoms. So we need to find those people who you were in close contact with in those days before you were sick and get them into quarantine so that we can prevent further spread and just further expansion of the transmission. So getting tested is absolutely critical. Home tests, they're getting, be more and more available for home tests. Still follow the same recommendations. I'd highly recommend you, if you get a home test that's positive, go in and get a test from a healthcare practitioner, get that recommendation from the healthcare practitioner as to what to do for your health, and follow the public health advice with that. But there are also, so Michigan Tech certainly is running testing, and there is new testing. The health department just released in our county, Western UP Health Department is now testing, I forgot to look at this. Correct me if I'm wrong. I think it's 9 to 3 every day at their Water Street clinic. But also Aspirus is doing testing. All of your healthcare providers are doing the testing as well. Express Cares, all of those guys will do testing as well.
Yep. Thanks, Kelly. We'll keep our time zone straight here, 10 to 3 Eastern. So, yep, great. We're going to keep the program going here, and it's my pleasure to introduce Professor Siddharth Chandra, who's a professor at James Madison College at Michigan State University. We are going to switch gears and go back about 100 years and learn from him a little bit about the importance of the Spanish flu and what are some lessons we can learn and apply those to help improve our understanding here of the current pandemic.
Thank you, Professor Elmer and Professor Cam for hosting this session, and also the Health Research Institute at Michigan Tech. So I'm going to briefly talk about some research that we've done on the 1918 influenza pandemic, which was the last, I think, major pandemic to circle the globe. There have been a few others since, but this is the event, I think, of reference to which a lot of people looked when the COVID-19 pandemic was starting, and people continue to look at it. Most of my research has been on countries in Asia. I've been working on this project for over 10 years. But in the past few years, I started looking at data from our own state, from Michigan. And there are some very interesting parallels and differences between the two pandemics. And I think a few things we can take away as well. So let me start by talking about some of the parallels. We think of the influenza pandemic of 1918 as having occurred in 1918. It actually turns out that it was a much longer pandemic than that. And even in the case of Michigan, it rolled on and on for approximately 2 years and perhaps even a little beyond then. For those who have the ability to see what I'm doing, I'm actually going to pop up an infographic, and then I'm going to tell you a little bit about what you would see on the infographic, whether or not you're able to see it. So let me pop up a first infographic showing you how this pandemic unfolds in the state of Michigan over time. Let's go to the screen share. Here we are. So what we have in front of us is a graph showing different waves of excess mortality. And what excess mortality simply is the number of deaths in excess of what you would normally expect to occur given the time of year that you're counting the deaths. And what we see in the case of Michigan during the 1918 to 1920 pandemic is we actually see 4 distinct waves. The first one occurs in early 1918 and in the spring. It goes away. It's quite bad, but after it goes away, everybody says, hooray, this is over. Hopefully it was a one-shot thing. And unfortunately, it turns out it's not a one-shot thing. It comes back with a real vengeance in October of 1918. In fact, it's so bad at that time that the governor of the time, Albert Sleeper, imposes certain restrictions on public gatherings. He imposes this in late October. After a while, he's met with a lot of opposition, primarily from businesses that are suffering as a result of the bans on public gathering. In 3 weeks' time, he actually lifts that ban, even though there's evidence that they're beginning to bring that wave of October 1918 under control, the wave of infections and deaths. And unfortunately, after he lifts the ban, we see another bump up in December and January of 1918, perhaps in part because he lifted the ban. And then by early 1919, again, the wave subsides and everybody thinks that this time they're done for sure. And unfortunately, come early 1920, February of 1920, Michigan sees a massive spike in cases and deaths. In fact, it's the worst single surge that Michigan sees. And for those of you who are following what's been happening with COVID-19, the parallels are really quite stunning. The COVID-19 pandemic has gone on for coming up on 2 years. This most recent fourth, some people are calling it the fourth wave or the fourth surge, seems to be the most serious of the lot. And this graph in some sense is what's happening to us today is almost an echo of what happened to us in 1918. A second point I want to make is just to tell you a little bit about how the infection spread as reflected by excess deaths. The spread in 1918 was a lot slower geographically across the different counties, the 80 plus counties of Michigan, than the wave of 1920. Basically what the maps I'm showing to those who have visual access is the different counties in which the cases and deaths are peaking at different points in time. And in 1918, what we see is a few counties peak in October, some other counties peak in December. So clearly there are different times at which we're seeing surges in different counties. In 1920, the wave happens almost in unison across all of the 80+ counties of Michigan. And so there are some very interesting questions about whether what we were seeing in 1920 was in fact a variant of what we saw in 1918, and perhaps even a much more contagious and rapidly moving variant. We don't know that for sure. We need to sequence, the genome and so on of those viruses. We need to find samples, but it's quite an intriguing question. The second thing I'd like to talk about, and I'm going to go through this very rapidly, is in 1918, when Governor Sleeper imposed his ban on public gatherings, it turns out that the pandemic had already, in October 1918, that wave had more or less run its course in the eastern counties of the Lower Peninsula. So if you're looking at Wayne County, where Detroit is located, Washtenaw County, where Ann Arbor is located, they'd already had the bulk of their cases by October 1918. That was not the case for central Michigan, Ingham County, for example, where Lansing's located, or the western part of the Lower Peninsula, Kent County, where Grand Rapids is located. And so the ban on public gatherings had, I think, a significant effect on the eastern side of the state. Perhaps it was even a little bit late. In the case of Ingham County, what it did is it brought what was shaping up to be a wave under control. And then we had a double wave, a second roughly equally sized wave in December. And in Kent County, because the ban on public gatherings came way too early, when it was lifted, Kent County had its wave, right? So again, these are probably phenomena that at this point you're all painfully familiar with. These kinds of restrictions do work. They do bring things under control. And when you let go of them, as you might expect, the virus gets to do the rounds again. I'll say one last thing, and this is a real contrast. It's just for you to try to imagine. One of the things that these kinds of pandemics do is because of the nature of the viruses that cause them, they are actually particularly harmful to people in particular age categories, right? We've seen this with COVID-19. Elderly people have disproportionately borne the brunt of COVID-19. That's where the deaths tend to be sort of concentrated. People who are a little bit younger have a much lower risk of dying from COVID-19. In fact, in the 1918 influenza, the virus also had a disproportionate impact on a particular age segment, but it was a totally different age segment from the one that we are seeing today. It was in fact people in the prime of their lives, people ages 20 to 40, who were dying in disproportionate numbers. And you can imagine that the havoc that was wreaking on society, because these were people who were out there working, providing for young children very often. We are beginning to study the effects on marriage and families. They're devastating. And they're very, very different from the kinds of effects that you see when a virus hits more of an elderly population, which is, of course, devastating in its own way, but in a very, very different way. And then finally, what are some of the surprises for me as a researcher? I'll just mention one. When the vaccine was announced, I said, wow, this is a game changer. People in 1918 didn't even know, in many instances, that a virus was causing the influenza. They were still in the process of discovering what viruses do and how they're related to influenza. We had the whole genome of this virus sequenced soon after the pandemic broke out. And I thought this was just going to completely change the game. And I think in retrospect, I was very naive, because part of the reason we are having this fourth wave is, I think, the lack of vaccine uptake and very large proportions of the population who are not vaccinated. And as a consequence, we're seeing a replay. Fortunately, a slightly more limited replay, but nevertheless a replay of what happened in 1918 now. So thank you very much.
One quick question for you that's come in is, we know that scientists and public health officials, Siddharth, are modeling and predicting what will happen over the next several weeks and months. Is there a way to capture and include some type of historical factor or data like you showed us here into those current models that would help us better predict what would be coming up in the future?
So the broad brush, in terms of broad brush phenomena, of course, right? And that's one reason I think researchers have been paying so much attention to what happened in 1918. And you can see for yourself clearly what some of the parallels are, right? But, the influenza virus is a different beast from the COVID-19, the virus that causes COVID-19. And we have to be keenly aware of the differences between the viruses and the kinds of syndromes that they cause and how they're transmitted. The world is a very different place today. It's far more interconnected. The Omicron variant is already in the United States. It came all the way from Africa. It would have taken a lot longer to get here in 1918 had that been the time when the virus came out. I'll just mention one other thing, and this is sort of a contribution of these Michigan studies, which we've recently published in the American Journal of Public Health, to potentially the management and the understanding of the pandemic in other parts of the world. We are very fortunate living in the United States to have so much vaccine available, right? I want a booster, I can get it tomorrow, right? We are able to test people. We are able to tell almost in real time how bad this pandemic is in different locations at the level of the county. This is really amazing, our surveillance capability. There are many countries in the world which don't come even close to having this kind of surveillance capability. And one of the things we've been able to demonstrate, I mentioned the age phenomenon to you, that there are distortions in the proportions of people of different ages who are dying at any given point in time when the pandemic is really bad, right? So in 1918, when we had the waves, is when we actually had disproportionate numbers of people ages 20 to 40 appearing in our death records, right? It turns out that we're seeing similar distortions in the age distribution across deaths for COVID-19. And those are data that countries that are severely under-resourced do actually collect. So we are actually developing ways to track somewhat in retrospect what's been happening in these countries, even in the absence of the capability to test for COVID-19, which is very expensive. So consider that a contribution of Michigan, perhaps to the understanding of the COVID-19 pandemic in the rest of the world. We've demonstrated it for flu, and we've now demonstrated it in a forthcoming paper for COVID-19 as well.
Great. Okay, moving on, we're going to welcome in Dr. Jason Bombard, who is trained in psychiatry. He works with Aspirus over at their Ironwood Clinic. So Dr. Bombard, thanks for coming back. I think this is your third time on the town hall. Really appreciate it as always. Tell us a little bit more what we can do to look out for our mental health and well-being.
Well, thank you very much for having me. I'm very glad to be back again. I do think the mental health pandemic that is going on currently is one that is somewhat hidden, but is definitely as far-reaching, if not more so, than the COVID pandemic is right now. I kind of wanted to talk about some specific groups, especially, and how it's affecting them overall. But first, I just want to say, we're looking at numbers of around 40% of Americans reporting some form of anxiety or depression with the current year's surveys that have gone out. This is up from about 11% in 2019. So this is huge. I mean, we're talking almost half of all Americans are experiencing some form of mental health issues secondary to the things that have gone on in this pandemic. And one of the things that we've seen with disaster psychiatry in the past, pandemic psychiatry, war-based psychiatry, and things like that, is that the mental health impacts of these types of events tend to be much longer lasting than some of the physical health ones. If you look at the 2001 9/11 attacks, the amount of anxiety, PTSD, and things of that nature that occurred in the year following that were enormous. And that's something that we can expect to continue to see as we follow this. Even if we were to get this under control completely, there still would be this ongoing wave of depression, anxiety, and other symptoms. The three specific groups that I really wanted to talk about, first being the elderly. That is a group that has been especially hard hit, as was mentioned. They are the ones that seem to be bearing the brunt from a physical standpoint of this illness, and it really has affected them in many other ways too, socially probably being one of the biggest ones. A lot of the things that the people that are middle age or younger have is work, which we still get to go to. We still have some social interactions there. A lot of the elderly, the retired folks had nothing left. Churches closed down. The social gathering places had all shut down for their own protection. And because of that, there really wasn't a lot of socialization. And it's been hard to get people back into that. We have actually opened up a geriatric behavioral health program in Ironwood, which is kind of a unique one for the area, where it's an intensive outpatient program, a full day program for older people to come in, get some group therapy, and also get some socialization. And that has really taken off much better than I even hoped for. So that's something that just shows how much there is that need. Another group that really is suffering a lot right now is the younger kids. School disruptions, again, social interactions have really been set back. I've read some studies that have shown that academically, we're looking at about a year's worth of setback to more sometimes, but socially that can be even more, potentially up to a 2-year setback in normal growth from a social standpoint for some kids, just because of this lack of normalcy that they've been experiencing. Kids don't do as well as we'd like to think they do sometimes with change. They like things to be the way they expect them to be, and this has really shaken their worldview in a lot of ways. So we've got that group, and then the other group that I really think is missed sometimes in all of this is our healthcare workers, our frontline people that are really putting themselves out there and exposing themselves to so much stress, so much things that they probably never signed up for. If you look at the symptoms of anxiety and depressive disorder among essential workers versus non-essential workers, it's 42 versus 30%. Increased substance abuse or new onset substance abuse in the last year is 25% in our healthcare workers versus 11% nationwide. And seriously considered suicide, this is the one that really gets me. 22% of healthcare workers report having seriously considered suicide in the last 30 days. That's horrible. It really is. I mean, these are the people that we're depending on to keep us healthy. And unfortunately, we're not really doing enough to keep them healthy right now. I think everybody in healthcare would probably consider themselves to be overworked and underappreciated sometimes. I think the frustrations that a lot of people are facing when we're doing the best we can in the healthcare world and people are still not doing the small part that they could do to make things safer for everybody else, it gets hard. And I think we all are facing quite a bit of burnout. If you look at the numbers of people who are retiring early or not re-upping contracts and things like that, it's happening all over now, and we are having a huge shortage. We do have some positives coming out of the COVID epidemic. One of the biggest positives in the healthcare, for mental health at least, I think, is the telehealth. We have really expanded our ability to telehealth, and the CMS has really kicked into supporting that now. We used to have a lot of trouble billing for Medicaid and Medicare when we were doing the telehealth appointments, but they're really behind that now. In fact, some insurance agencies report up to 50% of all telehealth visits are mental health. So I think that's giving a lot of people access that they hadn't had before. I know we're running kind of short on time, so I'll cut it off there. But my main point is, try to look out for everybody out there. Look out for those at-risk groups. Hug a healthcare worker from a 6-foot distance.
Great perspective, as always. Thank you, Dr. Bombard. We're going to turn it over to Elise Burr, who's the director of the Center for Rural Health over in Marquette at Northern Michigan University. So welcome, Elise.
Thank you. Thank you for the opportunity to participate in tonight's discussion. And I want to thank all of our healthcare workforce throughout the region for their efforts. These last 2 years have been very trying. Those of us who've worked in the healthcare industry, we already knew what challenges existed prior to this pandemic. And that's been nothing more than magnified since this. And although we try to work and collaborate on initiatives, this has certainly taken the spotlight, and been the primary focus. So the development of the Center for Rural Health at Northern Michigan University started last July in 2020. Heck of a time to start a new job relating to healthcare in our region. So it's been a little bit challenging, but overall it's gone pretty well. I hope to engage more with hospitals and clinics as the pandemic lightens at some point. Right now we're focusing on expanding access to care, improving the quality of services, identifying the needs of our region, and strengthening the entire overall health system as a whole. I've participated a lot in the regional 8 meetings that we've had, trauma meetings, health department meetings, and I just want to say kudos to our health system. There's a lot of silos that appear throughout geographic regions, but I've seen our region pull together and really help each other. And I think that says a lot about the people in the Upper Peninsula. Keep up the good work. As we work together to increase awareness, use these types of opportunities to educate people and really collaborate with those efforts. We can get more done by working together. Thank you.
Elise, we do have time for a question. What role do you see some of our Upper Peninsula universities and community colleges potentially partnering with your center, some of the healthcare systems? How can we help our students, staff, faculty, and educators?
I've actually been working with universities and colleges over the last year. That was easier than going right into the hospital systems. And one of the things I did was actually bring the counseling staff together. I wanted them to know that as they went through this past year, they're not alone. They need to know that there's others experiencing what they're going through. And so we were able to provide additional education and resources for our counseling staff. I've also been working on flu vaccination competitions between the universities and colleges. So that's been more of a fun focus versus COVID. Also taking a look at what can be added to curriculums. I think today's discussion and talking about the resiliency of our healthcare staff is something that we need to go back and take a look at our curriculums and make sure that we're emphasizing how to take care of yourself. It's not just everything else that's in a textbook.
Okay. Thanks, Elise. I'm going to turn it back over to our epidemiologist on the panel, Kelly Cam. We don't have time to do the rapid fire takeaways here at the end. We have to finish right on the dot at 8 o'clock Eastern. But Kelly, can you just highlight a couple of things and maybe a few take-home messages that really stuck out from your perspective?
Yeah, I think it falls on all of us to do our homework and to really get vaccinated. That if we want to get out of this, our vaccinations not only protect us individually, but they do protect our community for all the reasons that everybody has stated here. I think the other thing that in terms of our mental health for everybody here, be kind to each other. Don't kill the messenger. So in addition to the problems that our healthcare practitioners have had, a recent study that looked at our public health workers found that almost 12% of our public health workers had a threat, a job-related threat because of their work, and another 25% felt bullied or harassed because of their work. All of these people are out there trying to help you and help keep our community safe. Think of that. They're not out there to make life miserable. They are out there to help you and to help our communities get through this safely. So be kind to each other, be kind to yourself, get vaccinated, get your booster, get your kids vaccinated, stay safe, wash your hands, all of that stuff still applies.
And Kelly, I would add in one more, stay physically active. We know walking, physical activity, exercise is good not only for physical health, mental health as well. So just wanted to add that plug in there. Unfortunately, we're just about out of time here. I want to start to wind things down just by thanking and acknowledging our speakers and sponsors. So we really appreciate all of our clinicians and public health officials, our educators, community members doing their part, especially the folks on the Zoom webinar tonight. Kudos and shout out to Dr. Labani. He was treating patients right up until he said, Steve, I'm going to be joining a few minutes before and getting right back to it afterwards. So thank you, Dr. Labani. We appreciate everybody coming on and again, keeping our community not only health and safety, but informed for tonight. I want to thank our sponsors again, especially the Michigan Health Endowment Fund for their support. They've offered us a community health grant here to improve health, to keep our community informed during the pandemic. And all of our subsequent and associated community partners here, we couldn't do it without them. Finally, thank you to all of our listeners and viewers that are tuning in tonight, that have tuned in. Remember, if you missed any part of the recording, you can catch us this Sunday at 12 p.m. Eastern on ABC 10. So until then, have a safe holiday season, and we'll see you next time in 2022. Take care, everybody.